everyone and welcome back to my channel. You are watching Dr. Surabhi Sahney Dental Series and Medical Lectures and myself, Dr. Surabhi Sahney. Today I am going to talk about some clinical questions regarding Neet Mds. As I have selected few questions to discuss with you from the previous year question papers of Neet Mds. So without wasting time, let's get started. With the first question, here it goes on your screen. What is the temperature beyond which gypsum investment should not be heated? Option A, 1292 Fahrenheit. Option B, 1202 Fahrenheit. Option C, 752 Fahrenheit, and option D, 392 Fahrenheit. So what do you think? What will be the right answer for this question? So the correct option is option E, that is 1292 Fahrenheit. That temperature means 700 degrees Celsius. Actually, the investment decomposes at this temperature and releases sulfur, which will definitely contaminate your casting. Begin with the second question on your screen. The change observed in gingiva during pregnancy in the absence of local factor is option A, pregnancy tumor, option B, pregnancy gingivitis, option C, an increased tendency towards gingival bleeding, and option D, not notable. That means no change is seen. So what do you think? What will be the right answer for this question? So the right answer for this question is option D, that is not notable. That means no change is seen or observed during pregnancy in the gingiva with the absence of local factors. Now begin with the third question. Here it goes on your screen. Oral and periodontal manifestations of leukemia consist of option A, bleeding, option B, oral ulceration, option C, infections, or option D, all of the above. So what do you think? What will be the right answer for this question? So the right answer for this question is option D, that is all of the above. As leukemic cells can infiltrate the gingiva more, say less frequently as compared to that of the alveolar bone. Therefore, we are able to see the gingival infiltration in case of leukemic gingival enlargement. Now begin with the next question. Here it goes on your screen. Which of the following is synonym for infrabony pockets? Option A, intrabony, option B, subcrestal, option C, intraalveolar, or option D, all of the above. So what do you think? What will be the right answer for this particular question? Synonym for infrabony pockets. So here the right answer is option D, that is all of the above. That means whatever the options we have are all the synonyms of infrabony pocket. That is subcrestal, intraalveolar, and intrabony also. Intrabony pockets are basically those pockets in which the bottom of the pocket is apical to the level of the adjacent alveolar bone. Now begin with the next question on your screen. The color changes of gingiva is diffuse in case of You have to tell the particular condition in which you can see the diffuse gingiva. So option A is ANUG, option B acute herpetic gingivostomatitis, option C is chronic inflammation, and option D is anticonvulsant therapy. So what do you think what will be the right answer for this question? Here the right option is option B, that is acute herpetic gingivostomatitis is the right answer for this particular question. एक्चुअली जो कलर चेंज है जिंजाइवा का वो हम एक्यूट इन्फ्लामेशन में मोस्ट कॉमनली देखते हैं. एक जरा सी एक्यूट इन्फ्लामेशन क्या हुई जिंजाइवा में, आपका कलर चेंज इज द फर्स्ट साइन फॉर दैट, एंड फ्रॉम दैट then it distribute and carry on in case of chronic gingivitis. So that's why acute inflammation is the key feature of the color change of gingiva. Now begin with the next question. Here it goes on your screen. Gingivitis associated with mouth breathing is of option A marginal, option B interdental, option C diffuse, or option D generalized involving the entire dentition. So what do you think what will be the right answer for this particular question? You have to tell the type of gingivitis seen in mouth breathers. Here the right answer is option C, that is diffuse gingivitis. Gingivitis and gingival enlargement are found to be the most commonly seen in case of mouth breathers. The gingiva appear to be red, edematous, shininess is there on the exposed area along with diffuse surface. Now begin with the next question on your screen. All of the following group of drugs can cause gingival enlargement. Except is the main word in this question. Focus on this. Now, option A is calcium channel blockers, option B immunosuppressants, option C antidepressants, and option D anticonvulsants. What do you think what will be the right answer for this question? कौन सा ऐसा ऑप्शन है जो जिंजाइवल एनलार्जमेंट नहीं करेगा? मोर फोकस ऑन अ वर्ड लाइक एक्सेप्ट, व्हाट इज ट्रू, व्हाट इज फॉल्स, व्हाट इज नॉट, which is present in the question. Here the right answer is option C, that is antidepressants. The remaining options are definitely the example causing the gingival enlargement, a well-known consequence of the administration of calcium channel blockers, immunosuppressants, or the anticonvulsants. Basically, they may create a difficulty in mastication, in speech, in tooth eruption, and the aesthetic problems. Now begin with the next question on your screen. All of the following are true about idiopathic gingival enlargement except option A, it is confined to the gingival margin and interdental papillae only. Option B, the growth is leathery in consistency. Option C, the jaws may appear distorted. Option D, the growth may regress after extraction of teeth. So what do you think what will be the true regarding idiopathic gingival enlargement? The right answer is option E. That is, the idiopathic gingival enlargement will definitely affect the gingival margin, interdental papillae, and definitely affect the attached gingiva also. So option A is correct for this question. Begin with the next question on your screen. Narrow triangular shaped gingival recession, being shown in the figure also, is known as option A, Stillman's cleft, option B, Meckel's festoon, option C, fenestration, or option D, dehiscence. So what do you think what will be the right answer for this question? You need to focus on certain words given in the question. That is, for example, narrow triangular gingival recession. So what do you think what will be the right answer for this particular question? Here the right answer is option A, that is Stillman's cleft, because this is considered to be a special type of gingival recession जो कि narrow और triangular shaped में है. So that is the key feature of Stillman cleft, a special type of gingival recession. Begin with the next question. Here it goes on your screen. An isolated area in which root is denuded of bone is intact and covered only by periosteum and overlining gingiva. That is called option A, fenestration. Option B, dehiscence. Option C, infracrestal pocket. Or option D, hemiseptum defect. What do you think? What will be the right answer for this particular question? I have already discussed this question on Instagram stories also in the previous days. So the right answer is option A, that is fenestration. Begin with the next question. Here it goes on your screen. Virus that causes oral ulceration in immunosuppressed patient is option A, herpes simplex virus, option B, varicella zoster virus, option C, cytomegalovirus, or option D, Coxsackie virus. So what do you think what will be the right answer for this question? Here the right answer is option A, that is herpes simplex virus. Although जितने भी ऑप्शन में वायरसेस दिए हुए हैं वो सब कॉज करते हैं ओरल लीजन्स इन इम्यूनोसप्रेस्ड पेशेंट, लेकिन सबसे ज़्यादा मोस्ट कॉमनली अगर हम देखें तो उसका आंसर आएगा herpes simplex virus is the virus which cause most commonly oral lesions in immunosuppressed patient. जब कभी ऐसा कोई क्वेश्चन आए जिसमें आपको लगता है कि चारों के चारों आंसर हैं और चारों के चारों आंसर सही हैं, तो प्लीज गो टू द मोस्ट कॉमनली सीन, मोस्ट कॉमनली फाउंड, मोस्ट कॉमनली केसेस. Begin with the next question. Here it goes on your screen. Use of corticosteroid is contradicted in option A, lichen planus, option B, erythema multiforme, option C, pemphigus, option D, primary herpes. So what do you think what will be the right answer for this particular question? Here, so the right answer for this question is option D, that is primary herpes. Basically, the drug for herpes simplex infection is acyclovir, which is an antiviral drug. No antibiotic will help to treat this condition, and that's why corticosteroid is also contraindicated in this condition. Begin with the next question. Here it goes on your screen. The number of phodacis granules present on oral mucosa. Option A, increases with age. Option B, decreases with age. option C, remain constant, or option D, none of the above. So what do you think what will be the right answer for this particular question? So the right answer for this question is option A, that it increases with age. Basically, photiasis granules are the sebaceous gland which are seen in the oral cavity during the puberty, and after that it increases in number with age. So let's begin with the next question. Here it goes on your screen. Which of the following syndromes is associated with vascular lesions? Option A, Sturge-Weber syndrome. Option B, Gardner syndrome. Option C, Albright syndrome. Or option D, Peutz-Jeghers syndrome. So what do you think what will be the right answer for this particular question? Here the right answer is option A, that is Sturge-Weber syndrome. Begin with the next question. Here it goes on your screen. Which vein drains the cheek? Option A, mental. Option B, buccal. Option C, inferior labial branch of the facial. Or option D, superior labial branch of the facial. So what do you think what will be the right answer for this question? So here the right answer is option B, that is buccal vein will supply the cheek. Begin with the next question. Here it goes on your screen. Which vein drain both the lower lip and the chin? Option A, mental. Option B, buccal. Option C, inferior labial branch of the facial. And option D, that is superior labial branch of the facial. So what do you think what will be the right answer for this question? So the right answer for this question is option A, that is mental vein will supply the lower lip and the chin. Please don't confuse between the previous question and this question because the options are same. The sequence of the options is also same, but only the difference between the question, that in the previous question they are asking about the cheek, and in this question they are asking about the chin and the lower lip. So don't get confused. Begin with the next question. Here it goes on your screen. The solvent which is used to add dentine wetting in dentine bonding systems is option A, water. Option B, ethanol or acetone. Option C, carbon tetrachloride. Or option D, ethylene. So what do you think what will be the right answer for this question? Here the right answer is option B, that is acetone. Begin with the last second question. Here it goes on your screen. Which of the following is not an advantage of enamel bonding agent over a dentine bonding agent? Option A, decreased marginal leakage. Option B, better color stability. Option C, increased bond strength. And option D, decreased moisture sensitivity. So what do you think what will be the right answer for this question? Here the right answer is option D, that is decreased moisture sensitivity. It is not considered as an advantage because जो enamel bonding agents होते हैं, they are extremely moisture sensitive as compared to that of dentine bonding agents. So begin with the last question. Here it goes on your screen. A 64-year-old gentleman is brought with severe central chest pain, radiating to the left arm for the last 30 minutes. He is profusely sweating and is in agony. Which of the following disease he is likely to be suffering from? Option A, stable angina. Option B, oesophagitis. Option C, acute myocardial infarction. Or option D, pleurisy. So what do you think what will be the right answer for this question? Here the key feature is pain in the chest, along with it radiating to the left arm. Left arm is the key feature in this question. So, what do you think what will be the right answer? So, the right answer for this question is option C, that is acute myocardial infarction. So that's all about the clinical questions part 2 regarding Neet Mds questions. If you still have any query, you can drop me a mail which is shown on your screen. Thank you for watching.